pointed out, if you look at the most elderly folks, 75 and above, you are seeing a slight waning of efficacy against hospitalization, even with some of the vaccines. And so this is, you got to have all the tools in the toolbox here. So we were able to talk about it, raise awareness. There was a great feedback. People were like, man, I didn't know that was there. And so we said, you know what, there's a lot going on. We know we have these centers at different hospitals and all this other stuff, but let's make it more available. So we've been able to do the 21 sites. Again, over 40,000 patients as of right now have received treatment, and we're typically doing over 4,000 a day now, which is a really good clip. This site here in that we have in Merritt Island is in Brevard. Has done close to 3,500 people, probably more than that as of this night, because they're doing them as we speak. And I think this community in particular, the healthcare folks and everything, have really worked hard to alert people that this is something that they could avail themselves with. And of course, that site's open 7 days a week from 9 to 5. In this region, Central Florida, we also have one in Ormond Beach in Volusia County, and then of course at Camping World Stadium in Orange County. And if you'd like to find out more information about the treatment locations, you can visit floridahealthcovid19.gov. To register for treatment at a state site, you can visit patientportalfl.com. And prior to us setting up these sites, in order to get a monoclonal antibody treatment, you had needed a referral from a physician. What we have done, with the Surgeon General putting in a standing order, you don't necessarily need to have a referral. So you certainly can speak with your physician, and we encourage people to do that. But it takes away a step. And so if you're somebody that is infected and you meet the criteria, which are pretty broad, you're able to come in and do it. And so this has been treatment that's been proven to be beneficial to keep people out of the hospital, particularly people that are at higher risk of hospitalization. So folks who are elderly, folks who are overweight, folks who have problems with diabetes, kidney problems, cardiovascular, lung conditions. Those types of patients can really benefit from this. And so we would encourage folks to be able to do. Now, you got to do it early. This is something where when this hits, typically, obviously, most people recover without a problem, which is good. Most people have relatively asymptomatic or mild infections. What happens is people produce antibodies, they fight back the virus, and then they recover. Well, in some people, particularly the higher risk groups, those antibodies aren't necessarily produced to the extent they need to, so that's what this is providing. We're using Regeneron, but you also have others. It's basically an antibody cocktail. Puts it in, and then allows more ammunition in terms of antibodies to fight against the virus's progression. Once you get to the point where you're incredibly ill in the ICU, then taking it at that point is likely not to turn it around. And so if you do it early when symptoms are onset, it has a really good track record of resolving the symptoms. So we have some folks here who are talking about, and oh, by the way, we're using the Regeneron. It's free for patients. Folks, don't let anyone tell you they're going to charge you $2,500 or whatever. It's just not true. And it's also the only one that's approved for use as a prophylaxis. And we'll actually hear a story about that. And it's also the only monoclonal that's approved for subcutaneous. And so injections, you can do an IV for an hour, or you can do 4 shots and be done with it. And so that gives you a lot of versatility, allows us to do more. So we have Rob Dale here. He was diagnosed with COVID, and he was able to utilize the Kiwanis Island Park site here in Brevard County to get his treatment. So, Rob?
Hi, I'd like to first take this opportunity to sincerely thank the governor and his staff for making the program available, the Regeneron program. A couple weeks ago, I was diagnosed with COVID. The next day after diagnosis, we went down. They had just established the program, and for all I know, he and his staff may literally have saved my life and my fiance's life with the availability of this. I've lost family members. I've lost friends during the whole COVID issue. And the way that this worked, I was having symptoms, had fever, had heaviness in my chest, probably a little bit of fluid. We went down, we went and got the treatment. I was a little concerned. They talked about 4 shots, 2 in the belly. The belly has always kind of concerned me, kind of a sensitive area, but actually felt nothing, essentially, in the belly area. The arms were like regular shots. We went out, they monitored us for an hour, had no issues. That night was probably the worst of it. I won't sugarcoat it. I did have a little bit of night sweats and chills. The next morning, though, essentially the way I look at it is the serum. I actually joke about it. I call it the Captain America super serum, and it actually, I had no heaviness in my chest. All my symptoms were gone. My fever was gone. Still had to maintain the quarantine, and that went on for a while. But full recovery, and same thing for my fiance. So I am very thankful for the governor making this program available. Again, I would echo that. The first thing out of my mouth, I'm a financial planner. I wanted to know how much does it cost, and at no cost, it was a no-brainer for me. So.
Is she going to talk about, or you want to talk about the prophylaxis?
Michelle, would you like to?
Go ahead.
Well, Michelle, my fiance, was experiencing not diagnosed with COVID, but she took it as a preventative, which is one of the other reasons to get the serum. She has asthma, and we were very concerned about her getting it from me. I mean, we tried to separate ourselves, but you live in the same house, and it doesn't work out that way. But all I know is on January 2nd, I get to marry her because we're in good shape now. So I'm very thankful.
All right, great job. Okay, Bill and Joan, and come up and talk about. Yeah, whoever wants to be the spokesman, you go. You guys make it.
Want me to start?
I'll start. Okay, I'm Joan Grodzki. I'm one of probably the first ones who got the infusion, December 22nd. December 20th, started experiencing some coughing that became constant coughing. Went to a clinic, got diagnosed with COVID, told to go out the back door, that there was nothing that they could do to help me. Now, I'd like you to know that I did the preventative as far as wearing my mask at all times. I was taking the supplements that were supposed to help me. I did everything that I thought I should to protect me from getting COVID, and we still got it. I left there with some inhalers because I do have asthma and I do have heart issues, so I was very frightened with the diagnosis, thinking this is going to be bad news for me. Called my personal physician. He also was unable to help me. I was told by both, go to the hospital if you get worse. I'm a retired RN. That's the wrong answer for me. The answer is, let's do something that we can do now before you get to that point. Because as we all know, our hospital staffs are overworked. They're exhausted. We need to do something to help them also. So I was fortunate because my neighbor knew Dr. Todd Husty, who is Seminole County Medical Director. Dr. Husty called me and he said, let me help you. He said, there's something new out there called monoclonal antibody infusion. And he said, Advent Hospital Outpatient Infusion Center is offering it. He was able to get me in within 24 hours. Now, mind you, at that time, then I had a fever of 102.9. I had horrible racking chills and body pain. I was short of breath. I got in for the infusion. Within 24 hours, I did miraculous, turnaround. The coughing was barely there. The fever was gone. The pain was gone. I was so relieved because I felt it truly, truly saved my life. And unfortunately, my husband got it 4 days after me. And we're just so thankful that the infusion was available. And it was a little bit different then because the infusion took place over an hour. And they watched us for an hour, and for a week, they kept track of us on an app on our phone. So we had to give our vitals and our symptoms and what was going on, and if it didn't look right, they'd call us back right away. So things have definitely progressed in a good way, especially with the sub-Q being available now. So I'd like to turn it over to Bill, and anyway, thank you, Governor. We truly appreciate what you've done for us.
Sure.
Yes. I'm Bill Grodzki, and my story mirrors Joan's somewhat. But I am not retired. I work for a national home respiratory company, and my job is the liaison for the Florida Ventilator Center, which is located here in Melbourne. We provide ventilators for people at home, as well as other respiratory equipment. So I'm in and out of the hospital, the ICUs, almost daily, seeing patients and evaluating them, as well as their caregivers, to see if they're a candidate to go home on a ventilator. I was convinced that I was going to contract COVID. If I did, it was going to be from the hospital. However, it was on our little birthday vacation trip out of state where we contracted COVID. I was several days behind her. Fortunately, when I got symptomatic and I went to get tested and was tested positive for COVID, I had already seen what the monoclonal antibody infusion did for her. So I was not going to let them send me out the back door with directions to go to the hospital if I got worse. I insisted on a referral for the antibody infusion. They had to do some research. They made me wait in a little isolated room, and they had to look it up, and I provided them with all the information I could. Fortunately, the doctor sent me out of there with a referral to Advent Health's infusion center. The next day, the doctor told me, don't call them, they will call you. I kind of don't believe that because of my, how I operate in the hospitals and the lack of return calls that I get. But they called me right away that evening and said, can you come in first thing in the morning? So the first thing in the morning, got the infusion, and just like Joan, with all the symptoms I had, high fever, extreme fatigue, achiness, the next day, within 24 hours, I was well on the road to recovery, and within a couple days, I felt completely fine. Still had the loss of taste and smell, which was very frustrating, but all in all, it was, I felt also that it saved my life. I have an autoimmune issue for which I take immunosuppressive drugs, so I was at high risk for getting worse and not having a good outcome. So I felt truly blessed by getting the infusion, and I am so happy that not only is the general public being informed about this, but hopefully some of the doctors who I know in a lot of cases are still not aware or are not referring patients to these centers. Thank you.
Well, thanks for those testimonials. I mean, we're in a situation where, for a long time, the message to people that had contracted COVID was basically, from a lot of quarters, just go home and hope you don't get really ill enough to come to the hospital. And our message is, no, if you get COVID, particularly if you're in one of these high-risk groups, the message has got to be, there's early treatment available for you. Again, no one's going to force you to do this. This is your choice. You got to talk to your physician, do whatever research you want. But particularly when you have folks that very well could end up progressing to hospitalization, ICU, could even die, getting this early can really make all the difference. And so the days of just saying, go home and, if you get really ill, go to the hospital, those days have got to be over. They're over in Florida. This is something that's been available, as you heard the Grotsky say, since December of 2020. It has been utilized throughout Florida by a lot of different health systems. However, it was not something that the average person really had a good understanding of, and that was really apparent to us as we started to see these hospital admissions this summer. Now people understand, that they do have options to be able to do, and of course, early treatment goals to save lives first and foremost. And I guarantee you, if you look at those 40,000 folks that got the monoclonal, there's no doubt that some of them would have been hospitalized and some of them would have died if they did not have this. But it's also just a case, Most people that get admitted to the hospital do recover and they are discharged. No one wants to go to the hospital. You can prevent that and have a quicker rebound. I mean, that's really important too. Also, given that the hospitals had a very busy summer season, still busy, if people can be kept out through this, man, you got to do it. And then even short of that, just being able to be on the mend and get people back. I mean, you have, moms that have to take care of kids. You got people that run business. You got all kinds of stuff where this could truncate the illness and really make it something that is much more manageable. And so we're happy to see the response on this. We're obviously really happy to see the decline in admissions and the decline in the hospital census and emergency room visits. And we want to keep this going. But the goal is you got to bring every tool in the toolbox out. We've done almost 13 million vaccinations. That's been instrumental, I think, in protecting a lot of people from severe illness and hospitalization. At the same time, you got to do more. And I think as we've seen with big waves in places that have high vaccination rates, this is something that we got to take seriously. And it's something that we've got to do in terms of the treatment angle. So we're doing that here in Florida. And it's interesting. I'll get people now writing into my office from other states who will say, yeah, I had no idea this was there. Someone sent me, my sister sent me your press conference. And then lo and behold, I got COVID, a week later. And I look, and some of them can't even get it. And there's some states that they have a really tough time finding it. There were some either people said they were going to drive down from the Midwest to come to Florida. They have a house here potentially. So you see that, and so I think that we've raised awareness here, and which is obviously what we're trying to do. But also now more people are talking about trying to get early treatment, and I think it's really important. So thank you for Rob, and thanks for Bill and Joan for talking. We had some folks down in Southwest Florida, some really good examples, and then we were in Jacksonville recently with, you may have seen when we first opened that clinic a couple weeks ago, there was a woman who was in really bad shape. She's actually on the floor. Someone took a picture of it. It went viral. She then got the monoclonal antibody treatment. Within 48 hours was on the mend, and now she's back at it and was able to talk about the fact that had that not been there, she was destined for the ICU. So these are really powerful things, and it's really helping people. So we appreciate it. Okay, take some questions. Yes, ma'am.
Governor, thank you for answering my question. Do you or the DOE plan to dock pay for Orange County Public Schools? As I'm sure you've heard, they've enacted a mask mandate without allowing an opt-out for parents. I know the DOE wrote them a letter, and they have to respond to that by 5 o'clock tonight. Do you or the DOE plan to dock?
Yeah, I think the DOE, I mean, obviously, whatever they've done previously with the other folks that have not followed the law and have not given parents the opt-out, I think that they'll probably follow through. I know they're working on that, and I know you had a situation here in Brevard. It's interesting. Nobody has ruled against anything that we've done yet. I mean, that judge, unless something came out in the last hour, has not actually issued a written ruling on that. Of course, we will appeal immediately. We'll seek a stay of that. But here we are, days later, we still don't have it. I think part of the reason we don't have it is it's not an easy opinion to write from a legal perspective. I mean, I think it's going to be something that's going to be very vulnerable to being overruled. And remember, I always remind people, last year, we had school reopening in Florida. It was so controversial. People were talking about how disastrous it would be to have kids in school and all this other stuff. We knew the data. We understood. We had looked at what happened in Europe and other places. We knew that this was something that was important for our kids and our parents, and so we did. But they sued us on that too, and they won in Tallahassee trial court, and it was not a good ruling, obviously, and that got really strongly reversed on appeal. So I think we'll see something similar here. But at the end of the day, just honoring parents' rights and parents making these decisions, I think is really significant. It's interesting. I mean, think about if a different school district banned anyone from wearing a mask to come on campus, what would parents who want to have their kids wear a mask, they probably would go to the Parents' Bill of Rights and they'd probably sue, and they'd probably win because ultimately that is a parent's decision.
Governor, what should parents take away in the face of the judge's decision on Friday? Orange County has a new mask mandate. but they're not the only ones. During Brevard, Volusia last night. So what should parents take away this week? This is all ongoing.
So I would just say, I think there have been some local authorities who have violated the law and have basically taken the decision-making authority out of the hands of parents. And my view is that the parents are in the best circumstances to understand, because when you're talking about forcing somebody to wear, particularly these really young kids, to wear a mask 6, 7, 8 hours a day, the parent knows what effects that has on them. The parent's in the best situation to know how does that affect their learning, their attention, all these other things. And so that's what Florida law, I think, requires. And clearly, although obviously the vast majority of school districts have honored Florida law, you have some, that haven't. But ultimately, when it comes down to the students' well-being, I trust the parents more than I trust the government.
Governor, it's good news to see the case and hospitalization numbers begin to plateau and decline, but the death numbers have been going up pretty significantly. I wonder if you have any words you can share with families that are affected by that.
Yeah, I think it's been a rough time. I think there's people that have been infected or have been affected all across the state, and I think it's been a really terrible thing. And I think the thing that we're trying to do is say, okay, what it was not being done, where was the gap? And the biggest gap was in the early treatment. So I am confident that there are going to be people that are now being availed of this who are going to have better outcomes as a result of that. I do look back, and I kind of, when the Regeneron came out in December and the Eli Lilly, you didn't hear a big push amongst a lot of our expert class about getting early treatment. I mean, there's a reason why nobody knew, or very few people really knew. We knew Florida hospitals were doing it, and I think that would be something that was a big shortcoming. We saw the shortcoming. We've addressed it. But I do feel that had this been something that was just as a matter of course, I think that there are some people that would have had better outcomes. So I think it's a really sad thing when you think. Now we have people standing here with us who may not have been here were not for this treatment, and so we want all hands on deck, and we want to be able to help. But I think you look beyond just. I mean, we see the tools that we have, and in the statistics. You see the folks getting admitted to hospitals, and obviously you see it reflected in the mortality. Those tend to be folks who were not vaccinated prior to being infected, and then they were also folks, by and large, who did not get the monoclonal antibody treatment. So it's my view that if the tools that are available are used, and they are being used now, at least with the treatment, you will see more people be able to handle this, and that's ultimately what it's about, about saving lives.
What happens if the school districts choose not to comply?
Well, I think you've seen, so I think in Alachua and Broward, the Board of Education has withheld salaries from the elected politicians, the school board politicians, and that's something that I think will probably be in the hopper for stuff going forward. And then, of course, we'll see what happens with this written order, and then see what happens with the appeal. But I'm very confident that we'll have an appeal. I think some of them now are saying, well, since you have this judge or whatever, they're saying, well, we may not have to comply. Well, there's no order in place telling you don't have to comply. And so, but I think they'll be disabused of that notion very, very quickly. Okay, thanks, guys.
The federal government that they may subsidize with the pay?
The federal government wants to bail out union-backed politicians with tax dollars. That is not a good use to bail out politicians.
You done good.
I got you today, but I respect you got one last time.
Nice to see you in the office. How are you? Good. You know what, my leg fell asleep. Every time how's life? Get up. Yeah, I'm gonna roll forward. Other than the fact that my leg's gonna take a minute or two. So what do you got going on right now? How do you do this?
Just waiting to see how things shape up for the session. We started that.
Anything new about your time?
Yeah,
What's your time at all?
We're all waiting to see how that shakes out.
It's really interesting to watch this summer. Amenities and whatnot.
Yeah, it's all good.
Now that it's a crisis, I think people finally understand. Yeah. Yes, I agree. They don't want USA to say anymore. Sure.